Thank you so much for tuning in to Science TV. Welcome to segment 2 of this special interview with my guest from Jubilee Insurance. And he will be introducing himself, and we are talking all about insurance and health insurance, and he will be telling us more about what Jubilee Insurance does. This is Chris Mololo, and my sign language interpreter is Gideon Minor. Now straight to our guest. Thank you so much for making time. Introduce yourself before we start.
Good morning, my name is Kenneth Agunda. I'm a general manager at Jubilee Health Insurance, in charge of operations.
In charge of?
Operations.
Operations.
Yes.
Okay. Welcome to Science TV. So as we begin, you can start by telling us what is insurance and what is health insurance. Make us get the difference.
Thank you, Chris. Health insurance. Okay, let's start
by
insurance. Insurance is protection that you receive against financial losses. When I say financial losses, financial expenses that arise in our everyday life. A typical example is if you insure your car and if your car gets damaged, then because you have suffered a loss, the insurance company compensates you for the loss of your car. Yes.
Yeah. Now tell us about health insurance.
So health insurance typically covers you for medical expenses.
Okay.
In your everyday life, we all fall sick and we require to go to a hospital. When you go to hospital, hospitals will charge money. So stepping back, once you have insurance, it means that you have paid a premium to an insurance company in return for cover that will pay for your medical expenses in the event that you are sick.
Okay.
Yes.
Now, why should everyone have health insurance?
It's important that we all have insurance because we don't know when we will fall sick, and we don't know the extent of the expenses that are going to arise from our sickness. If you are sick and you are admitted in hospital for a long time, you are likely to incur very large costs, and those large costs, by the way, will, if you do not have insurance, it means that you will have to get money from your pocket or sell some property in order to pay bills in the hospital. So that's why it's important that you have some sort of insurance, pay a small premium in return for a cover that caters for your medical expenses.
Okay. And I think you've answered the question well. How can someone choose the right health insurance plan? Because we've heard of many insurance plan, we don't know which is the right one. Educate us about that.
So there are various products that in our terminology within the insurance industry we refer to them as products. So they are not tangible products like products you carry from the shop, but we refer to them as products. So there are many, and that the choice of those particular products are dependent on an individual's situation or circumstance. So for example, if you want to make a choice of an insurance product, you need to look at what your budget is like. Just like this is
your financial situation.
How much money do you have that you can spend on insurance? Once you have made that determination, you also need to look at what is your family circumstance. So you choose a plan based on your family circumstances. If you have, for example, 2 children or you have 3 children, tied to the fact that you need to have a budget, it means that your expenses in terms of buying insurance are likely to be higher. Also, people who have small children, you have the tendency for children to fall sick. However minor the ailments are, they cost money and you need protection against those expenses if you have a family. So it's important that you look at your circumstances as you make a decision in terms of how much insurance to buy. And
so even size of the family is one of the factors to consider?
Yes, it's important that you look at that, because the more number of people that you have in your family, the likelihood that you'll have one or two people that will fall sick within the year, within the month. Yes.
So do you mind telling us some of the insurance products that we
currently have?
Yes.
Yeah, thanks, Chris. As an insurance company, of course, we respond to various segments of the market. We have insurance products that cover corporates.
Okay.
We also have insurance products that cover individuals. When I say individuals, we call them retail in our space.
Yeah.
That means you as an individual, you walk in and you buy the product to cover yourself and your family.
Yeah.
We also have within the same health insurance space products that cover SMEs, small to medium enterprises. Groups of 3-4 people they come together and they buy insurance for their organization or for the employees and their families. Yes.
Okay. And as a firm, have you set up inclusive communication structures to ensure all persons get information correctly as you intend?
Yes, we do have. We respond effectively on issues pertaining to, well, basically everybody, but also including people with disabilities. So typically, for example, if a customer who is visually impaired, at Jubilee we have set up our customer care center is on the ground floor.
Yeah.
So, and if the customer would not be able to use the ground floor or requires to go upstairs to another office, the building has lifts, so the customer is able to be directed appropriately to the right office. Just I need to hasten to say that our staff are responsive to situations of people that would come into our offices and that would have any sort of impairment or disability, and they deal with the customers in an empathetic and in a manner that helps supports the customers. Yes.
That's good. And what are some of the common misunderstandings about health insurance? You know, when anyone hears about health insurance, there's what they understand and could be different to the other. Like how I understand health insurance may not be the same as the other person understands it. So what would you say are some of the misunderstandings about health insurance that you've had?
Yeah, in my experience, I've and especially you know, as Kenyans, we believe a health insurance is for rich people.
Yes.
That is not true. Whilst there are products or solutions for people that have a high net worth or who are rich, so similarly we also have products that cover people that are not well-to-do.
That are affordable.
Exactly. Products that are affordable. So I have spoken in the past about one of our products called Coverbora, which an individual would pay a premium of 6,200 to receive a cover of 250,000 shillings for inpatient cover. If you think about it, 250,000 shillings as a medical bill is quite large for an individual to pay from their pocket. But it is possible for an average Kenyan to afford 6,000 shillings to pay as insurance and get cover that helps them in the event of sickness in hospital. The other thing that I know about misunderstanding is that people perceive insurance as complicated, not very difficult to understand. So we make it our point that we explain whatever that is provided in the insurance policies to customers. Either our agents or our customer care representatives are available to provide all information pertinent for customer satisfaction.
Okay. And that brings me to my next question. You've mentioned how people perceive health insurance to be complicated. Why do some people think like that? Or how is Jubilee Insurance addressing the need for affordable health insurance solutions in Kenya?
Yes, like I mentioned, first of all we make it simple for a customer to understand what exactly they are buying. We also explain the product and we provide information about that product, including, Chris, you'll also be pleased to know that typically an insurance policy, once you buy as an individual, you have up to 30 days to decide whether you, after reading the policy in detail and understanding it some more, if you did not understand it, to decide whether you want to continue with the policy or not. So again, we have our customer representatives that are available to explain policies. We also have our own staff are available. If any of our customers would reach us, we will provide all the required information that a customer requires, so that it is not perceived as complicated.
I'd like you to clarify something here before we proceed. When someone comes to get a policy, do you only do the explanation, or you also give written information for them to read?
Yes, that, as you know, Chris, these are so-called contractual matters. Once you come to us, we will provide written information. We provide both written information in terms of product information, and ultimately after the customer has signed up, we also provide a written policy document, which is the evidence of the contract that exists between that customer and the insurance company. So all these transactions are actually in writing. So it is not just a verbal information. Whilst we explain, we also provide written information for the customer's consumption.
Okay. What happens when, let's say, a person with disability, like let's say a visually impaired person comes to get a policy? Do you have someone who reads the information to them and then you do the explanation where they've not understood, or what happens?
Yes, we have that is option available for persons with various disabilities, not just visually impaired. But speaking to the visually impaired, yes, there will be somebody who can explain the product in detail to the person so that they understand what they are actually buying.
Okay.
Yes.
Nice. So what advice would you give to our audience who is thinking about getting health insurance but isn't sure where to start?
So first things first, one, I'll talk about us as Jubilee Health Insurance. You first of all need to know that we exist as a company, and our physical location, where it is in Nairobi, Wabera Street. That's one. Two, we need to make decisions in terms of buying health insurance. In this country, the number of people that are actually insured is a very small fraction of our population. We would advise, so that we avoid this michango when somebody has a medical bill in a hospital, that you buy insurance ahead of time. it will help you at the time when you have those medical expenses. Even if the medical expenses are beyond the policy that you have bought, but you will have started from somewhere. So then you will be helped. So let's make a decision, buy health insurance. We are available both on our social media platforms. We have a telephone number which I'll also provide at the end of this session that customers can actually reach us.
Okay.
Yes.
I think you can just tell us your social media handles and provide that phone number, because we are about to conclude the interview. So proceed.
Yes. The first thing I would, of course, direct our customers to our website, where you'll find all our X handles, all on our Facebook accounts. And I'll also say that we are available. If you can send us a text, just a minute, I will tell you the number here. So if a customer wants to reach us on phone, just a minute. So we can be reached on phone on 07099 49 000. You can also send the word health as an SMS to 40643. So
please repeat the phone number.
So the phone number is 0709 949 000. Yes.
Then the message.
If you want to send us a message, and our customer service representatives will revert to you as soon as possible, is 40643. You send the word health to 40643.
Okay. All right. So what would be your final remarks as we end this interview session?
So my final comment to my fellow Kenyans is that let's make a decision today to buy health insurance for the protection of our families, to avoid incurring expenses from our pockets. It's very easy to budget for a premium, but it is very difficult to budget for a medical bill. Because for premium we know how much it is, for medical bill we don't know how much it is. Exactly.
Good advice from Kenneth Agunda from Jubilee Insurance. Of course, you've heard the information that he has given here, the importance of having health insurance, and I hope you will make a decision to get one. This is Chris Mololo. My sign language interpreter has been Gideon Minor. Once again, Mr. Kenneth, thank you so much for making time, and to our viewer, thank you so much for watching this session. We hope to see you again some other time. Have a nice time and keep it Science TV. Goodbye.